Hello everyone, I'm Dr. Sean Liu, an orthopedic surgeon dedicated to helping people stay mobile and pain-free. Today, let's talk about something very common, knee pain when stair climbing. You might notice discomfort going up, down, or both. And while it may seem like a small issue, it can often point to something deeper happening in the joint. Let's explore what that could be. Climbing stairs put more load through the knee than walking on flat ground. In fact, the patellofemoral joint, where your kneecap meets your thigh bone, can experience several times your body weight in pressures during stair use. If that area is irritated or misaligned, pain often shows up during this kind of movement. Here's some of the more common conditions that could be contributing. 1. Patellofemoral pain syndrome, or PFPS, sometimes known as runner's knee. PFPS happens when the kneecap isn't tracking smoothly along the groove of the femur. It's often due to muscle imbalances, poor alignment, or overuse. The pain is typically felt around and behind the kneecap, especially when bending or loading the joint. 2. Early cartilage wear. As the joint surface thins with age or repetitive strain, activities that involve bending, like stair climbing, can become uncomfortable. This may be an early sign of chondromalacia or developing osteoarthritis, particularly if you have noticed stiffness, kicking, or swelling after use. 3. Muscle imbalance or weakness. Weakness in the quadriceps, glutes, or hips can change how the knee handles force. If your muscles aren't absorbing load properly, more stress is placed on the joint itself. This is often a modifiable factor with proper physiotherapy and strengthening. 4. Previous injury or altered gait. Past injuries, like ligament strains or meniscal tears, may affect how your knee moves, and sometimes leading to compensations that show up during specific activities like stair climbing. You don't need to have a sharp pain to benefit from a checkup. If you notice increasing discomfort with stairs, a down leg behind the kneecap, swelling or grinding, or the sense that your knee is avoiding load, it's worth having an access to determine what's driving the symptoms. The earlier we identify the cause, the easier it is to manage with targeted strategies and reduce the risk of long-term joint stress. Knee pain while climbing stairs is common, but it's not something you need to simply live with or brush it off as normal. Understanding what's going on beneath the surface allows for more specific treatments, whether it's strengthening, modifying activities, or addressing joint mechanics. Every knee tells a story, and the pain with movement is often the body's way of asking you to listen.